Hi, everyone. My name is Bethany Williams, and today I'll be presenting to you my Module 5 discussion. As we all know, Victoria is a very lazy girl who's decided to start an exercise routine that she follows every single day, which is jogging. Some of the cardiovascular changes she'll see is an increased cardiac output, which means that there will be increased blood flow in areas that need it and decreased blood flow in areas that don't need it. This means that blood will be pumping through the skeletal muscles, which will increase her body's temperature, and therefore more blood will be pushed toward her skin. Her heart rate changes. Why is that? Due to the increased cardiac output, more of her muscles that are being used need more oxygen to circulate through them, which means that her heart rate will increase. The purpose of this is to induce a higher amount of blood circulation throughout her body in its entirety. The sympathetic nervous system is what is used because it releases hormones that encourage her heart rate to increase. Her blood vessels are vasodilated, which means that the arteries are widened. This is in response to low oxygen and increased body temperature, which means that there's increased blood flow to areas that need more oxygen. In terms of the precapillary sphincters in her quadriceps, they are open. As you can see in the picture at the bottom, on the left-hand side, they are closed, and on the right-hand side, they are open, which allows for more blood flow. This means that they are recruiting more true capillaries to help dump the oxygen and pick up the carbon dioxide. This removes waste and pushes electrolytes into the working tissue. Why is her face red? On the right-hand side, you can see a runner who's finished a run whose face is bright red. This is exactly what Victoria is experiencing because she has produced an increased volume of blood, as I spoke about before. Her blood vessels are vasodilated and blood is rushing to her skin due to the elevated body temperature she is experiencing from the run. Most of the blood is going to her working muscles rather than the organs that aren't being used. The skin, skeletal muscle, and cardiovascular system are the organs that are receiving the blood flow. The digestive organs are not receiving as much blood flow due to them being unnecessary for her job. The autonomic nervous system is what is being used because it controls smooth and cardiac muscles and glands. This is an involuntary action that activates these responses. The respiratory rate is that her muscles are not used to this. This means that she'll need to inhale to get more oxygen and exhale to get rid of the excess carbon dioxide that she is producing. Her breath rate will increase to about 40 to 60 breaths per minute. The bronchial tree. Bronchodilation is going to occur. Smooth muscle is what controls the regulation of the bronchial diameter. This is because the bronchial smooth muscle goes through the bronchial tubes that changes the diameter based on the needs of airway and oxygen needs. The parasympathetic nervous system is what activates this action to happen because it stimulates its responses and controls the nerves that impact bronchoconstriction, bronchodilation, and mucus secretion. The long-term effects are decreased heart rate and decreased risk of heart disease. She will also have efficient lungs during her future cardio sessions, as well as an increased strength of her tendons, ligaments, muscles, as well as increased bone density. Her digestive tract will be improved because she will have a boosted metabolic rate. She will have a lower likelihood of receiving or having mental illnesses due to their increased serotonin levels, as well as increased mood regulation, concentration, and better sleep. She will have a reduced risk of hormonal and immune responses to stress by keeping her immune system healthy. As you can see here, one of the common ways to find your pulse is the common carotid artery. It is found at the top of the neck and the base of the mandible. The brachial artery is found at the base of the brachial muscle. What this is that flexing it shows you where the base of the muscle is, and by releasing it and relaxing it, you are able to find the medial side of the biceps tendon. That allows you to feel where the artery is. The radial artery is found at the radial side of the wrist. This means that is on the outside part when you are facing. The femoral artery is found at the crease in a seated position by the hip with the knees bent. It is very deep to the skin. The popliteal artery is found at the relaxed bent knee, very deep to the popliteal fossa. It is one of the hardest arteries to reach to feel the pulse. The posterior tibial artery is found at the posterior to the medial malleus, and this is where you can see it on the right-hand side. The dorsalis pedis artery is found in between metatarsals 1 and 2. If you spread the metatarsals out, you are able to palpate and feel it between them.